Hi, and welcome to Policy Unpacked, a podcast by Global Policy Network. In this series, we dive into the policies shaping our world, from healthcare to sustainability to education, and we explore how these critical areas intersect to drive meaningful change. Whether you're a policymaker, practitioner, or just policy curious, we're glad you're here. Let's unpack policy together. My name is Amina Ghazel-Sachi. I'm the founder and CEO of Global Policy Network. And in this episode of Policy Unpacked, we're joined by Minesh Parbat, ICS Chief Pharmacist at NHS Shropshire, Telford and Wrekin ICB, and a leading voice in pharmacy transformation. We're diving into his personal journey, current role, and what lies ahead for the future of the pharmacy workforce and policy. So welcome, Minesh. How are you today?
No, thank you so much. Thank you very much, GPN, for this fantastic opportunity. It's a real pleasure and honour to be able to talk to you all today about, my career, but also, my view of the future of pharmacy as well. So thank you very much for this opportunity.
And thank you for joining us. I'd love to dive a little bit into some of your personal insights and your journey. So, what first inspired you to pursue a career in pharmacy?
I think it's one word, and I specifically remember just being curious and absolutely fascinated between the interplay between science and people.
Mm.
And pharmacy very much appealed to me from that viewpoint because here we are. I can apply my clinical knowledge and actually have a tangible impact on patient care and patients'
Mm.
lives. So I've always been, intrigued and curious about and believed in the power of medicines and how that can improve health. But more importantly, how I could be part of a profession that could almost empower people through access, education, and you know what? Trust. That is so important. So from a young age, it was that curiosity, going to that community pharmacy after, being taken to the GP surgery for, maybe a bit of a cough. And then this going into the pharmacy, and then this individual comes out with his bag, and a bottle in that bag, which contained this yellow liquid, and it was almost like it's like banana, but it made me feel better within almost like 2 to 3 days. So I appreciate we have a different view on antimicrobials, and we need to steward them, but that was where my curiosity grew, and my belief kind of grew in how medicine can absolutely empower, how patients can actually get better and support them in the best possible way.
That is so great. And looking back on those early years, were there any early influences, mentors, family, or moments that shaped your outlook on the profession?
Absolutely. My parents very much instilled a strong work ethic and a deep sense of responsibility and opportunity to serve the community. And very much in my early career, I had the privilege of working under a number of inspiring pharmacists who weren't just technically excellent, but they were compassionate and caring. And I had the privilege of meeting a lot of these influential, inspiring, pharmacists and as well as pharmacy technicians throughout my career, and that very much started from working for free during the summers, doing a summer placement in the local hospital, and as well as following my pre-registration year, my pre-reg mentor, and every single person that I've actually had a touch point of has absolutely inspired me. But my parents have provided me with that foundation to have a strong work ethic, have a deep sense of responsibility, and an opportunity to serve the community, which is really, really important. But there's an additional bit here, is having the ability to lead. I'm a leader, and I lead with humility and purpose that actually shapes my own vision for leadership within pharmacy as well. So leadership is really important to me, and that's something that I have a personal interest in. And I believe my parents have actually demonstrated that leadership and given me that platform to actually build on as well. So yeah, they're my early career influences and mentors as well.
That's great. And walk us through your journey to becoming a ICS Chief Pharmacist.
Yeah, so I very much started my early career in community pharmacy, and I still have, and I've got to admit, um, I still, if I had the opportunity, would love to go back and work in community pharmacy. I recently worked at a festival in a
Mm.
similar community pharmacy setup, and it was nice to be back. It was so lovely to be back in that setup, albeit it was a festival. But I only to say that that was a really um, important time in my career, starting off in community pharmacy, learning about different roles, learning about business, becoming more commercially aware, driving business, as well as managing staff as well. And that very much gave me a strong foundation to remain patient centered, having that patient centered focus in everything I do. Then I moved to the pharmaceutical industry, and I can honestly say that it was a really rewarding opportunity for me in which I learned the art of communication, presentation, but also gave me an insight into how the pharmaceutical industry influence and provide access to medicines which are life-saving and support patients day in, day out. And over the time, I did a lot of traveling, and then I decided to take on a maternity cover post in a local primary care trust, so a PCT. I'm sure a lot of the listeners would have heard and viewers would have heard of PCT, CCGs, and ICBs, all these acronyms. So, primary care trust was my first entry into the medicines management space as it was then, and I'm talking old money. And that provided me the insight around working with general practice, influencing change, managing prescribing budgets. And then I started to lead on projects and developed various initiatives, incentive schemes. I had a real good opportunity for 6 years to then move into a CCG role. And I believe that that CCG was a first of its kind. It had almost over 50 odd pharmacists, a systems leader in how pharmacists and pharmacy technicians could absolutely work in general practice effectively, not just offer a commissioning role, but also offer a clinical role as well. So a lot
Mm.
of those pharmacists in that space were prescribers. They were very much frontline. They had all had a work plan, and I really enjoyed that. So almost like one day a week, I'd be working as a clinician in general practice, seeing patients, doing medication reviews, answering queries, reconciling documents from hospital and so forth. And that was really enjoyable. But I had the fortunate opportunity to also 4 days a week work in the commissioning element and be able to support various committees, policy design, formularies, support the access of medicines, and implement wider strategic projects, which was really good. I got to a stage where I felt I very much needed to go back into frontline clinical care, develop and build services with the experiences that I built. So then I moved into a strategic role within Primary Care Networks, one of the largest within the system that I was working in. And that gave me an opportunity to lead various services around not just pharmacy and pharmacy technicians, but also, leading paramedics, physicians associates, training nurse associates, physiotherapists, and the list goes on. And that gave me an opportunity to really start to shape care that's actually received at
Mm.
almost a ground level, which was really important to me. I thoroughly enjoyed that role. I think it naturally came to a fruition for me where I needed to take that next step. And I delved into and took the opportunity and grasped the opportunity to be a systems leader. Now, this role is very dear to my heart in that I have the opportunity to really put the experiences that I've had over the last 19 years very much into action, to be that systems leader, to start to shape healthcare strategy, to also influence upwards, but also influence into the system as well, and create that change that's actually required. Because I believe that, we're still not getting the best out of medicines. We're still not as outcomes focused as we should be. So, as a systems level chief pharmacist, I want to be absolutely part of this integration and transformation efforts across the entire system. So, I mean, there's a number of stories I could tell through my career path, but in a nutshell, that has been my career trajectory and opportunity so far. And I'm so grateful for, to all the people that I've met on this journey as well, that I've interacted, connected with, that have been inspiring to me. So yeah, it's certainly been an interesting journey, and yeah, that's been the route so far.
And what about now as an ICS Chief Pharmacist? What does your typical day look like?
A really good question. I can honestly say that every day is a school day. There is no such thing as a typical day for me, in honesty. So my time is very much spent on strategic meetings, touching on policy development. One of the areas that I'm really passionate about is around workforce planning. I have a deep desire to make sure that not just the next tranche of pharmacists and pharmacy technicians have a place and space to be able to learn, develop, and grow, but also our current legacy workforce. What are we going to do with them? How do we ensure that we're able to optimize and make sure that they are actually operating to the top of their license safely, competently, and confidently? So workforce planning was very much one of those areas that I'm really interested in focusing on. My one of my biggest roles, in all honesty, is connecting dots. So how can I link up with primary care, with community pharmacy, with secondary care, to wider system partners? So it's a very much a facilitation role, and kind of like someone in the middle to actually have that grip and control to a certain degree, but also be that individual that creates opportunities, open doors. So no day's typical. I can honestly say today was not a typical day, and tomorrow certainly won't to be a typical day. So I have my calendar planned out, which is packed, but who knows what comes in. So it's just one of those. How can I say? It keeps me on my toes for sure.
And when you're not working and shaping healthcare strategy, what are you passionate about outside of work?
Um, at the moment, I love being outdoors. I have a keen passion to walk. I love trekking. Gives me that opportunity very much to reset. It helps me reset. I'm a keen believer of making sure that not just physically we are, um, you know, physically in shape, but also mentally in shape as well. I think we need to also focus on our mental health and well-being as well. So
Mm.
I love walking. I love trekking, and I also have a real interest in various genres of music as well, and exploring new artists. I've got a keen interest in uh, Indian classical music at the moment, which I'm really enjoying exploring. And of course, I enjoy spending time with my family where I can. My job is busy. It can be challenging, long hours. Um, but where I can now, and something that I've really started to focus on now, is where I have the opportunity and I carve out the opportunity to spend time with my family. It's of quality, and I'm almost fully concentrated and committed to that 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 space, and I think that's really important. So can't encourage it enough.
Mm.
Making sure we take some time out, because it's imperative that we reset, because yeah, we have to reset and reorganize and go back at it again every single day. So yeah, that's what I do, and that's my passions outside work. I like to read books as well on occasions. But yeah, at the moment, walking, enjoying listening to Indian classical music, and spending time with our family where I can.
Fantastic. And let's explore policy together a little bit. So, How do you feel the chief pharmacist role has changed over time?
Yeah, so I mean, the traditional role of a chief pharmacist is kind of almost that strategic operational leader. And I think today the chief pharmacist role is not just a steward of medicines, but is almost like a systems leader who shapes policy, integration, supports things like digital transformation, and is very, very much integral part of that workforce strategy development as well. So from moving from an operational role, it's about how can you start to work as that systems leader, which is really, really important. And to be honest with you, to kind of expand on this question further, it really demonstrates the skills that pharmacists and pharmacy technicians also have that are transferable, because we're not just clinicians, regulated professionals, but we have these leadership skills that we can very much tap into, that gives us the opportunity to think wider than medicines. Medicines is our almost like the bread and butter of what we know, but it also opens up a door to a world of other things as well that could absolutely influence, provide knowledge, bring people together, and shape various discussions as well. So yeah, it is very much a role evolved. The term, can be perceived to be very much strategic operational, but I would say that now it's very much as a systems leader, and I very much envisage that you know that it's an imperative role, and we need to have this pharmacy clinical leadership, particularly as we navigate ourselves through the new 10-year plan and the new landscape around integrated care boards and whatever that looks like as we move forward.
And how do you see the role of the chief pharmacist evolving over the next 10 years?
A great question, and I've had a real good think about this, and I very much would like to see chief pharmacist or whatever, and we envisage the title to be called, is very much embedded as part of population health and preventative care, very much having a key focus on digital transformation, because I believe that without the population health experience and exposure and the know-how, we will find it difficult to actually deliver on that preventative care strategy. But also, the biggest enabler here is that digital space. So
Mhm.
we need chief pharmacists and experts to be able to triangulate that and actually bring all those elements together to kind of support the government shift. And I also think that chief pharmacists will play a larger part in shaping integrated care systems, integrated neighborhood teams as well, and very much driving health equity through the access of medicines and as well as education as well. And I think that's a really important point around the education space. We've still got a number of patients that don't know what they're taking, don't know why they're taking it. We need to move that space around shared decision making when it comes to patients accessing medicines and taking medicines. We need to make sure that our focus over the next 5 to 10 years is very much value added as well as outcomes focused as well. So that's where I foresee it. I think we're going to obviously we're going through a period of change. I think the next 5 years are going to be very crucial.
Mhm.
But I also feel that there's a real opportunity here where we can start to support the access of some really good um, devices and medicines, and done correctly, we can commission correctly, but also hold. And I've been talking about this for a very long time. Is how do we move to a space where we hold the drug molecule and the clinical research that's been undertaken almost to account and says, okay, right, you're telling me this, actually at a population health level, does it actually do as it actually says on the tin almost?
That's fantastic. And do you feel we need a different type of relationship with industry in order to do that?
I think we will need to, and if we're not already building those relationships, we need to start building them very quick. I feel that there have been some partnership attempts that have been very successful, but we should start to move from policy to pilots to almost progressing to scalability. And I think that, we do the policy bit, we do the pilot bit, but actually we don't do the scalability element of it. And that's where we get very much stuck almost, is right. Okay, well, how do we get economies of scale within the National Health Service? We've got, the model ICB blueprint very much talks about the pay model and how that will evolve, how that will change. And my advice would be is that, the NHS and the industry need to work closer together to start to build those relationships of trust, but also start to unravel how that operational element will work. So trust, relationships, and then progressing on to how we're going to start to get into that delivery stage as well.
And what do you see as being some of the biggest barriers to implementation of policy?
I think some of the biggest barriers is obviously finances. We always find that finances are a major issue. They continue to be an issue. We are very much starting to focus on outcomes, and it's imperative that whatever we commission, there's a robust evaluation process in place. And in the absence of that, actually you inadvertently create a barrier. So I would say, in terms of one of the biggest areas around policy implementation is, yes, finances, but actually that evaluation space, and whether we're actually evaluating what we're commissioning in the most effective way. Because then and then only whether it's done as it's meant to do, be it a medicine or a device or whatever service or pathway we're commissioning. And I think there's a big gap there that we absolutely need to fill. And I think one of the core drivers in my experience is around making sure we've got data that's meaningful. So we talk about population health, but actually, does that data give you the information that you actually require to make a call on whether you'd want to scale this service up or not? So yeah, there lie some issues that we need to continue to focus on. But I think research evaluation are very much going to be crucial around making sure that we can effectively deliver and implement policy as well.
And what changes or reforms do you hope to see in the next decade? And how do those align with your broader vision for the future of pharmacy?
I'd love to, and I'd really like to see full integration of pharmacy into a multidisciplinary team across all care settings. Now, you would say, I would say that, but absolutely, because for me, pharmacy, and I want to be clear about that, pharmacists and pharmacy technicians, as well as the wider pharmacy workforce, we have got a lot to give. And, we've been doing this for a very long time. And I feel that, with the reforms that are ahead, I think this is a key opportunity where we can start to integrate more effectively. I appreciate there are political challenges on various contracts and finances. But hey, look, the challenge has been set, is how do you start to integrate pharmacy into a multidisciplinary team to cover all care settings, to make sure that, one of the biggest interventions that could be made, which is prescribing of medicines, dispensing of medicines, is covered by the appropriate professional. So I'd very much, like to see full integration of pharmacy, and that could mean that we have, pharmacists and pharmacy technicians that lead care pathway design. We expand on their clinical role. I spoke about how do we get pharmacists and pharmacy technicians to operate at the top of their license, with competence and confidence. How do we start to build that, and how do we make sure that we have that voice at that strategic level, and we have that presence at every commissioning discussion. So that's where I am with this, and I think here's the opportunity. Challenge has very much been set.
I love that. And are there any global healthcare systems you think the NHS could learn from when it comes to pharmacy integration or innovation?
Very much been envious of the Scandinavian systems. That comes to mind, where pharmacy is really deeply embedded into primary care as well as public health. So, when we talk about that prevention space, Scandinavian countries, I believe, and what I've read and colleagues that I've met do that really well. And there are models, their models offer lessons on how we can empower pharmacy as a profession to maintain patient safety and have systems efficiency. So these models are very much focused on efficiency, but they're also primary care orientated, deep rooted. They have long lasting relationships with patients, and that's so vital. So not only do we have a system here in Scandinavia that talks to each other, but also puts pharmacy as one of those key delivery models at the heart of ensuring that patients are safe, but also the system's efficient as well.
And what about the role of technology in improving efficiency and outcomes in pharmacy?
So this is a very much a live issue. We're still living in a space where we've got one piece of tech that doesn't talk to another. And this is 2025. I hope when people are potentially listening to this in 10 years' time, we've got to a resolution. I genuinely hope, where it's easy to prescribe digitally. We've got remote access. We've got effective AI support that supports clinical decision making. And this is the biggie for me, seamless record sharing. Why are we still having this battle? Why can't a patient turn up to an A&E, a community pharmacy, GP practice, to a mental health clinic, etc., etc.? And why are those records not integrated? Because how great would it be that you can move from one setting to another and the clinician is able to treat you in the most holistic way based on the information provided? It sounds very simple, but that would be the game changer for me. So the most important one for me is that seamless record sharing. The challenge is ensuring that the tech enhances, so rather than replaces. I still feel that the human element of care and kind of that compassion is so fundamentally important. I think we should not be. This is about how do we drive efficiency, but rather than replacing, because that human element is so crucial. So key enablers, technology is an enabler, but this shouldn't be about how do we reduce workforce, etc., etc. This is about how do we relate to our patients better, the people better, and how are we able to serve them better.
And in your view, what should be the single biggest priority for the pharmacy profession right now? And what do pharmacists need most to navigate these rapidly changing times?
So the biggest one for me in 2025, as I speak to you, GPN today, Amina, is around workforce sustainability. We need to make sure we invest in training, progression in pathways. And you know what? I spoke about this earlier. We need to really focus on well-being of our pharmacy workforce. Pharmacists also, and pharmacy technicians and my pharmacy family almost need to recognize support and the tools to enable them to actually work to the top of their license, and what support infrastructure is required. I think investments required in this space as well. I think a better look. We've had the workforce. We've had a number of workforce surveys that really delve into the EDI issues that we've got, but also we need to also support that agenda. But in addition to also making sure that we support our new workforce that's coming in, but also our legacy workforce as well. So workforce it has to be the priority. Our number one asset it is the people. If it was frankly honest, if we don't have them, we can't deliver the service that we need to. So it's imperative from my viewpoint.
And like you said, workforce well-being is a growing concern. It's incredibly important. And what would be your advice to healthcare leaders listening to this podcast? What can they do to support the pharmacy workforce?
Absolutely. So I think So I did a master's in healthcare leadership, and one of the imperative bits of my dissertation was talking about cultures within organization, and we need to start to create cultures where well-being is prioritized and not just become an afterthought. So it's not reactive; it's almost like a proactive, and it's built in to from when you start the job to the first 100 days and beyond. We need to create that inclusive culture. We need to make sure that we're also aware of cultural sensitivities, and we need to make sure that when we're planning for workforce, we're actually got staffing at a safe level. We've got that psychological safety, and one of the things that I'm really passionate about is around career development. So if I'm here today, what does my next 5, 10 years and beyond look like? And that that might be a bit of a um, start of the 10, but also there's flexibility in that career development plan, because I might like to I might want to do X, Y, and Z within the next 5 years, but actually it's really cool and it's fine if that changes, if those priorities change and you decide to take a different route. So I would say culture is really imperative, and making sure that we prioritize well-being as well within this for our workforce.
And are there any good examples that you've seen within systems or leaders with getting this right?
So I think the latest one for me is around the freedom to speak up guardians, which are embedded within NHS organisations. I think it provides that safe space for individuals to raise concerns, to escalate issues, to have that safe space to have those conversations as well. Uh, and those kind of opportunities are not just the nice to have, but they actually, in my opinion, directly improve to a certain degree, maybe retention or job satisfaction, because you know far too often you may experience challenges and you may not feel comfortable speaking to various individuals, but the freedom to speak up guidance is one of those examples where I feel that um has is that opportunity to really support staff and staff's well-being.
Absolutely. And when we think back to the COVID-19 pandemic, it was a really pivotal time and it really transformed how a lot of professions were perceived, especially frontline staff. How do you think the pandemic caused a shift in how pharmacists were perceived by the public?
Well, absolutely. I think in my experience of someone that was um, very involved with setting up COVID vaccination clinics, but also supporting from a community pharmacy viewpoint as well, the public saw pharmacists and pharmacy technicians as an essential, accessible, and a highly trusted profession.
Mm.
It was a turning point, I believe, to a certain degree in the public's perception. We weren't just that shop. We were actually an establishment, a healthcare setting that provided access. Albeit, we had to adhere to social distancing, but pharmacy absolutely stepped up, and we need to capitalize on that. I know the energy around that has maybe dwindled to somewhat, but we also need to reflect back and ensure that we capitalize on these opportunities, because primarily the trust factor was, it, it was so imperative that we made sure that we embedded pharmacy in public health and made
Mm.
sure that the doors were open, how they supported patients, how they got supplied to the most critical patients at the time of need. And this also applies to, I may be focusing on community pharmacy, but I'm absolutely conscious of what my colleagues have done in other sectors, including hospital pharmacy as well. So let me be completely clear that I'm talking about pharmacy during COVID in its entirety, because you know albeit community pharmacy was very much at the forefront of this as well, but there are pharmacy colleagues that worked night and day through these challenging times. And you know what? I'm going to use this time to say thank you. Thank you to each one of them. So, yeah, I thought I'd get that one in, Amina.
Thank you. And what strategies are leaders using to ensure the long-term sustainability and growth of the pharmacy workforce?
So, what we're seeing is workforce pipelines being built. through various different models. So that might be systems working with higher education institutes, working with further education institutes as well. So, making sure that we're starting to um, put pharmacy on the map, putting the system on the map, and all the opportunities that your system could actually offer you in terms of maybe a rotation placement, maybe a speciality interest that you may have. But in addition to that, I think we need to get in there early. So
Mhm.
working with our schools, sharing the importance of working within pharmacy. Look, I was talking to a pharmacy technician at a meeting last week, and they were out with a student from school, and the student interestingly said, "Goes, Miss, pharmacy's boring, isn't it?" And what was really quite interesting, after the pharmacy technician gave a robust insight into the journey of how to be a pharmacist or a pharmacy technician, and gave a bit of more of a broader understanding of what can be achieved and what impact you'd have within pharmacy, the student absolutely changed their perception and actually said, "You actually do more than I actually originally thought." And that was really inspiring. And that was a positive output for me,
Mm,
going out to those schools and colleges and really starting to influence influence in that space and making sure that pharmacy could be a career destination.
mm,
So, yeah, I think that this is imperative. And I feel that they're the kind of strategies that we're trying to build on now, start to build a long term sustainable growth within the pharmacy workforce. And I think I'll end on this point. I think we also need to grow our focus on more flexible working models as well, um,
mm,
and leadership development. Again, I have a biased view on that. I think leadership development is absolutely crucial, and I've done various pieces of research into this space as well globally. And I would say that we have to start to embed leadership very much from day one, crossing all undergraduate years,
mm.
moving into the postgraduate as well. So I think leadership, we need to make sure that we embed.
And what advice do you have for early career pharmacists? And is there anything you wish someone had told you at the start of your journey?
Goes back to my day one journey around remaining curious. My curiosity has driven my passion, ambition for a profession that has given me so much, my family so much, enabled me to serve my people, my community, the population that I work in. I would say curiosity is really important. I would say you need to find a good mentor. I'd say coaching is very much imperative. Never underestimate your mentors, the capability of your mentors, and the influence that they have on you, and coaching as well. And I wish someone had told me if it's okay not to have it all figured out from the start.
Mm,
I can honestly say, and when I lecture to undergraduate pharmacy students, I show them this one slide where it's almost like a bowl of spaghetti. Where I
mm,
first remember when I first came in to the world of CCGs, I kind of mapped out this is where I want to go, and actually, it hadn't turned out like that, and that's completely fine. It's completely okay because it is a bowl of spaghetti because you just don't know where your things are going to end up. You just don't know where one start point and then the other one's going to end. But just go with the flow. Remain curious. Find some good mentors. Find some great coaches. And you know what? Career development is non-linear, and still, we just need to get that deep sense of fulfillment out of whatever we want to
mm.
achieve, whatever we want to do. So that's my advice in a nutshell.
And it's great advice. And now I'd like to explore your role as an advisor at Global Policy Network. So, what excites you about GPN's mission and vision, and what got you involved?
If I was honest with you, I really like GPN's vision to create a collaborative space that holds almost that focus on system shaping and conversations that very much resonated with me. And it builds a platform where policy meets live experience. So it's almost like you develop a policy, but how do you go about implementing it? So, and I appreciate that may not be the entirety of the role for GPN, but starting those conversations, collaborating, facilitating these conversations helps build that innovation. And that's absolutely where we need to be focusing on.
And you're going to be chairing one of our policy roundtables in September. And you're also joining us at the HEC conference in October, where we'll be having roundtables in person. So, what can listeners expect from you and your work at GPN?
Absolutely. So I'm leading a roundtable on pharmacy role in integrated care and primary care workforce, and I very much want to bring together clinicians, commissioners, as well as policymakers, and make sure we've got listeners that can expect honest dialogue. That's so important. We've got a number of challenges within pharmacy, but I think that honesty is really important. We need to provide practical insights because not necessarily policy is can be attributed to practical implementation. So we need to be honest, have honest dialogue, have a real insight into practical insights as well and practical implementation, and have a shared commitment to those actions as well. So my roundtable will be very much challenging everyone around. Well, actually, we've had this conversation, which is absolutely great. We've come out with some great ideas. Well, what next, and how are we going to go take away these core messages and ideas and concepts to really start to shape policy for the future? And inevitably, this is about improving the care that people, patients, our relatives, family members, and friends, all of these people actually receive. So that'll be the true end point for me. And that's where I'd want listeners to really listen into and make sure that we hold our roundtable to account.
And why does your work at GPN matter to you personally?
I think for me, it's not just about the policy for the sake of policy. It's about real world impact, as I aforementioned. And, as GPN grows in exposure as well as capacity, GPN gives that voice to the front line. And I'm passionate about making sure that pharmacy is included in that space, in that wider healthcare conversation as well. So that's what it means for me personally.
And let's go to a quick fire round. So, what in the healthcare sector would you change tomorrow if you could?
Interoperability of systems, making sure one system can talk to another. Simple. Seriously, we need to get there. Why are we not there? Don't know.
I agree. So, tell me about someone, whether it's a person you know or a public figure, that has really inspired you.
Ato Gwande has always inspired me. I love the books that he writes. I love the blended science, the storytelling, the humanity in healthcare is something that really inspires me.
And if you weren't doing this job, what would you be doing?
I'd probably be looking to do something in international health development, still in healthcare. I love that, but at a global scale and tackling almost systemic health inequalities that I've personally seen having traveled parts of the world. So international health development, that's where I'd very much would love to put my energy if I weren't a pharmacist and working in pharmacy.
And are there any particular countries around the world that would be of most interest to you on an international policy project?
India's absolutely close to my heart. So I would say India would be a real opportunity, but I'd also like to, my parents are East African, so I'd love to support the African continent in some way, shape or form. Again, an opportunity for me to say thank you for supporting my family when they left India to come to Africa. So yeah, absolutely. Africa and India would be my where I'd like to potentially give back.
And we're so proud as well to be working with countries in Africa at GPN. So we have our Nigerian policy series, and we're now developing one in Ethiopia as well. So we're looking forward to having you as part of the GPN team on those. And for a final question to you, who would you like to see on this podcast in the future? Is there any organisations or individuals that you'd like to do a shout out to?
Do you know what? I'm not going to mention any names, but what I would say is I'd love to hear from a frontline community pharmacist who's very much innovating local care models. They
Mm.
often go unheard. They're the actual local heroes, but their stories are powerful and essential. So I would set that challenge, Team GPN. Let's
Yes.
see if we can get a community pharmacist that has really led the way and demonstrated some real good clinical leadership and impacted patients, if I was frankly honest.
And we love that. We love a challenge. So we'll be out there. Hopefully, our next speaker would be a community pharmacist. So thank you so much, Minesh, for your time. This brings
No
this
worries at
episode to
all.
a
Thank you.
close. Is there anything you'd like to add to our listeners just before we go?
Stay in touch, keep listening, and keep innovating, and make sure that you share, follow, make sure you tap into everything that GPN are doing, because I think the future's bright, definitely, for sure.
Thank you so much. And it's been such a pleasure having you on this podcast, hearing your perspectives on where pharmacy has been and where it's going next. So to our listeners, join us for our next episode where we will be offering more insights, and follow us on social media for our updates, and see you next week. Take care. Bye-bye.